Hi, Dimitri. It's nice to see you again. Today we're going to be doing the respiratory and the abdominal exam. Okay? So if you have any questions, just let me know, okay? All right, so I'm just going to start by inspecting the chest diameter. It should be about a 2-to-1 ratio, and yours is, so it looks good. And now I'm just going to come and percuss on your back, which means I'm just tapping. And I'm listening for resonance, which means that there's air present. And I'm doing this systematically and in a lighter fashion. And right here, it just got dull. It changed from resonance to dullness. And that lets me know that I've hit something solid. And in this case, that's the diaphragm. So that's normal. That's okay. And now I'm just going to listen to your lungs in the same fashion that I percuss, okay? So I'm listening for any adventitious lung sounds. So when I place the stethoscope on your back, I want you to just take deep breaths for me, okay?
Okay.
And breathe. Okay, good. And now the front. Okay, good. So your lungs are equal anterior and posteriorly. There's no rhonchi or crackles or wheezes. They're clear and vesicular bilaterally, so that's good. So now I just want to check for transmitted breath sounds, okay? Mainly bronchophony and echophony, okay? So I'm going to check bronchophony first. So whenever I place the stethoscope on your back, I want you to say 99 instead of taking breaths, okay?
99, 99, 99, 99, 99, 99.
Okay, good. Now the same thing except when you say the letter E.
E, 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 E.
Okay, good. So that checked the cacophony. So when you said the letter E and the number 99, they were muffled and indistinct, which is good. That's normal. We want them to be that way, or else it might be indicative of a pneumonia or a consolidation, okay? So that concludes the thoracic and lung exam, okay? So now I just want to move on. I want you to lay down for me. So I'm going to do a quick breast exam, and I know normally we don't think of that as something for a male, but we are. We're going to go ahead and do that. I'm just going to inspect and palpate to the nipples and the areola, looking for any nodules or swelling or any ulcerations. And they're not enlarged, so that's good. If you were a female, I'd be having to do much more. Starting at the tail of Spence, which would be up here, and palpating circularly, checking for any dimpling or any retraction or discharge from nipples. So being that you're a male, you've got it pretty easy. All right, so that's the breast exam. And they look fine. I'm going to move on to the abdomen now, so make yourself comfortable. So I'm just going to inspect the stomach, and looking at the contour, your stomach looks nice and flat. I don't see any masses. I'm also looking for any scars or any lesions, maybe indicating any surgery. And I don't see any, so that's good. So now I'm just going to auscultate in the 4 quadrants of your stomach. And I'm just listening for your bowel sounds. So in between 5 and 34 per minute is normal. Yours are nice and active, so that's good. And I'm using a diaphragm with that. So now I want to switch to the bell. I'm going to listen to the aorta and the renal arteries for any bruise, okay? All right, I don't hear any. So I'm just going to deeply palpate for the aorta. You have prominent pulsations anteriorly, so that's good. If it were more lateral, I would think that maybe there was an aortic aneurysm, but you're fine. So now I'm just going to percuss the abdomen. I'm going to do that in the same fashion that I did the auscultation. And I'm looking for tympany here, and that's just air in the stomach, or the intestines as well. and that's normal. But if there's any dullness or anything like that, that could just be fecal matter, which is fine. So that looks good. So now I just want to check your liver span. And so what I'm going to do is I'm going to palpate from the sound of tympani to the sound of dullness, okay? And right there I hear dullness. So now I'm going to start at the top and I'm going to go down. And now that's dullness. And so your liver span is between those two spots of dullness. And yours is about 6. That's like the mid-clavicular line of the lower abdomen. And yours is about in between the 5 or 6. So between 6 and 12 is normal, okay?
Mm-hmm.
So now I'm just going to palpate the edge of your liver. I'm going to go under the costal margin. Just take a deep breath for me. Take a deep breath. Okay. Good. Let it go. So I was just looking for the liver to bump my fingers as you took a breath. So that's good. Now I'm just going to percuss the left costal margin, looking for any signs of enlarged spleen. So I'm going to start medial and move lateral. Past the mid-axillary line. Good. Let me hear anything. So now I'm just going to palpate your spleen. I'm just going to reach over, okay? And again, I just want you to take a deep breath. Good. It didn't bump against my fingers, so that's good. So now I just want to do some special maneuvers. I just want to check for acute abdomen. So I'm going to do rebound tenderness. I'm just going to press in and release sharply. Was there any pain?
No.
Okay, good. So that's a negative rebound tenderness sign, okay? So now I'm going to check your psoas sign. So all I want you to do is just lift your leg against my hand. Good. Is there any pain? All right, good. So that's a negative psoas sign. And that would indicate any pain would be like maybe from an irritated appendix, okay? So now I want to check the obturator sign. So this checks the same thing, an inflamed appendix, so just, and I'm going to internally rotate. Any pain? Okay, good. So all those tests are negative, so that's great. So now I just want you to sit up for me. I'm just going to check for CVA tenderness. Oh, come on. Okay, so all I'm going to do is just percuss around the back of your kidneys. Was there any pain?
No.
Okay, good. So that's a negative CVA tenderness test. And that concludes the exam. So thank you for participating, and you have a good one.